Hi, I'm Lucy Caldwell, the Director of Communications for the Fairfax County Health Department. And today we're fortunate to have Steve Black, who's a manager with Emergency Services in the Fairfax-Falls Church Community Services Board. And Steve is going to talk with us about different services that are available for our residents in times of a mental health crisis. And Steve, I'm so glad you could be with us to have a brief conversation today, especially in the wake of such tragic national tragedy that happened yesterday in Texas. And we use the term mental strength to define people's ability to be able to cope with certain events in their lives, regardless of how challenging those events might be. And so I want to talk a little bit about how, just here as we open, that mental strength and what you're seeing. And do you have any suggestions for all of us today who may be struggling with just coping mentally with our own families and with our own situations in the wake of this tragedy and this trauma?
Well, thank you, Lucy. I do appreciate the invitation. And I think you bring up a very salient point. When national tragedies like this occur, everybody's ability to cope is different. Their exposures to their past, how that impacts the present, and how they absorb the information that's presented to them. And I think it's really important for people to know that they need to monitor how they're feeling. You know, are they feeling overwhelmed? Are they feeling upset, hurt, anxious? And if so, they can reach out to other individuals that they use in their natural coping cycle, like family, friends, faith members, to help build that mental strength and develop that resilience that they've used in the past to get through tough times in their life. I would also caution people that to observe how much content they're actually observing of these tragic events. Vicarious trauma is a real, and it does offer opportunities for people to absorb too much material that may be tragic or traumatizing, or it may trigger things from their past. So, being able to kind of monitor yourself in these incidents and see how you're feeling and reach out to either a professional like myself or those around you who are in your natural support network to help build that mental strength and resiliency that you normally use to deal with various traumas or tragedies in your own life.
Well, that brings me to a thought is, what is normal? What is a mental health emergency?
Mhm.
We talk about emergency services, and while we may know what that is, a lot of people might not. So, what is an emergency? How do you define it? And when do people know to come or to contact the CSB's emergency services?
Right. Well, I like the term behavioral health emergency because I think it encompasses everything that we do here in the CSB. And when people are feeling overwhelmed and that their natural supports are no longer capable of addressing their needs, I think that's what constitutes the emergency for that individual. It's different for everyone. What one person may experience may not be classified as an emergency as it would be to another. And that's different for various age groups as well. An emergency for a child, when they don't have the resilience or exposure or past history to develop the skill set to address certain losses or perceived losses, certainly can be more overwhelming than it would be for an adult who has gone through many more of life's trials, tribulations, and survival. And when you are able to kind of pass through those fires, you build that mental strength and that resiliency that allows you to handle different traumatic events or without being as easily overwhelmed. So if you are feeling overwhelmed, you can certainly contact the CSB's emergency services at the number below, or you can walk into our emergency service center that's manned 24/7, 365 days a year, and you meet with a licensed therapist and discuss what's going on in your life and maybe access those supports that you may not have.
What defines an emergency? How do you know when to come? What is that defining moment in your experience? You've been with the CSB for over 20 years. And you've seen emergencies, and that's been your primary role is to face emergencies with our 1.2 million people who live in Fairfax County. And I think it would be of interest to understand what makes it an emergency. When do people come versus when they can relax and see how they're doing and maybe try something talking to people as you had suggested for the next day, to have to try to ease themselves. And along with that, if someone did show up to the center there in the Merrifield area, what could they expect? What would happen to them or their loved one?
Well, I would like to first respond to the first question of what is an emergency, and I think that's really a spectrum that crosses the entirety of the human experience. What may be an emergency for you may not be for me, but what will constitute it is really if you feel that it's overwhelming to your current level of coping. And so if you feel that way, I strongly encourage people to seek out a professional and talk with them and figure out how to solicit more resources to help you get through and to build that mental strength and resiliency to get through whatever emergency you're in. If somebody were to come to the emergency services, they would be coming to our site at Willow Oaks Corporate Drive. They would sign in with our admin staff and at our kiosk, and then they would meet with a licensed professional to actually discuss how their emergency is affecting them. And then we will work with them to try and solicit what supports there are naturally for them to utilize to get through that crisis in that moment. And if they lack the resources, we'll try and connect them to those resources needed to actually build that resiliency and hopefully really develop a coping strategy and network that they can use for the next time that they might feel overwhelmed or in some sort of emergency or crisis at that time.
With so much going on, thank you, Steve. What are some of the trends you're seeing? And are you seeing an uptick in the number of people seeking your services?
Mhm. I think that we are seeing an uptick in the need for our services, particularly in children. I think the school system is much better at identifying kids who might be involved in some sort of emergency situation or might be anxious and need additional supports, and they're reaching out and making those referrals to us. I also think that our law enforcement partners are better educated to mental health crises through the CIT programs or crisis intervention training programs that we have established here, as well as the mental health first aid programs. And both they and our fire and rescue partners are referring people in for treatment. So whether or not there's an uptick in crisis, I can't really speak to it. But the fact that the word is out, that we're here, that we're available and able to help people, I think is a good trend to see. And people are accessing the county's resources when they need to.
Yes, because there's so much discussion about a need for mental health services,
Right.
not only in our community, but around the country, and especially for young people, like
Mhm.
you've mentioned. It can be a really confusing time. How would a parent or a grandparent or a caring adult know that their child might need emergency services?
Mhm.
And I would think maybe that would be considering taking their own life or something of that
Mhm.
nature.
First and foremost, don't be afraid to ask those tough questions. Asking somebody if they're feeling suicidal will not implant that thought into their brain. And actually, the research has shown actually allows them the dignity and the freedom to explore those concepts with you and to have those conversations. So what we would always say is bring those negative things out into the light and have those conversations with your child. And you're the best judge as to whether or not they're at their baseline and normal activities, or whether or not there's a change of behavior, and whether that's due to substances that they may be taking or exposures at school that may make them a little bit more anxious or cyberbullying. You know your child. So if you feel that there's a difference, feel free to call us at that number and we can have a conversation and talk to you about what the options are and where you might be able to seek help, whether it be with a CSB or using some other outside resource that you may have access to, whether it be faith-based or some of our professionals in the private sector, like Innova, who may be willing and able to accommodate you as a new patient or client as well.
Sometimes it seems so easy for somebody to pick up the phone and call 911 when
Hmm.
they see something, a wreck or, an
Right.
accident of some sort. But it can be harder to call for a mental health emergency, can it?
It can. I think there's a stigma that exists around mental health conditions, and I am seeing that barrier starting to break down. We're seeing actually advertisements on prime time for mental health diagnoses and medications and treatment modalities that we've never seen 10 years ago. And because of that, I think that there is more honest conversation happening within households and within communities in general about how mental health treatment affects people positively and the need for it, and connecting those individuals with professionals to address those crises when they're feeling overwhelmed and unable to seek them themselves. And I think that's one thing that really needs to be addressed here, is that your loved one may not be able to address their own crises. They may need assistance. And again, you can feel free to call us. We can talk through the possibilities, the options. We'll walk you through everything from any voluntary connections to care or even involuntary care if it's needed.
I was going to ask you about that. Are there times where people can be committed or institutionalized against their will?
Lucy, there certainly are those times when that is a necessary treatment modality. What we do at Emergency Services, though, is we will try every other avenue before we resort to that. We are mandated to look at the least restrictive intervention to address that individual's crisis. And what that means is we're going to meet with you as the collateral provider, as well as the individual. We're going to try and solicit the cooperation of the individual and the family to try and address that crisis in that moment. And if we aren't able to find the resources out there in the community, or if the person is reticent about connecting to those resources to maintain their safety, then certainly we will look at involuntary admission to a hospital. But the parameters for that are very narrow. We have to be able to prove that the individual, due to a behavioral health concern, is a danger to themselves, danger to them, to others, or unable to care for themselves or protect themselves from harm. And along with that, we'll have a conversation with the magistrate and then walk the family through the process and the individual as well. We will explain that process. And again, we'll try and solicit their cooperation to avoid that involuntary process.
I think that's really important to share with people because you can imagine that so many parents or loved ones of a young person might have just be exasperated and exhausted in facing a continuous either substance use issue or
Mhm.
mental health crisis with their child or a young person in their life, or even middle-aged person who may still be in their life, who is experiencing these types of issues. So I can imagine that there are people who come in and say, here, do something. I can't
Right.
live with this anymore.
There are those people that are really overwhelmed. It's not just the person in crises. The crises spreads to the family unit and the friends and
Absolutely.
support networks as well. And people can get compassion fatigue. And what that means is that, we've given everything that we can within our capacity to provide for this individual the support that they need and the direction that they need to seek treatment. And we're just so fatigued by that now we're needing to access other avenues of care and accessible treatment avenues. And so people come in and they're quite overwhelmed and anxious, not just the person in crisis, but the family in general. And so we do take our time working with the family, honoring their own personal struggle with that individual, and really discussing with them the capacity for ongoing care. And maybe they need to solicit some assistance as well and link to some care provider to support them. We've referred people to NAMI or asked them, to utilize their own insurance resources and help them connect to therapists or a provider or even the general practitioner that may be able to help them through, a limited introduction to an antidepressant. All around, the support of that individual and their family member who may be in crisis.
I was going to ask about that, about support networks. Are there support groups at the CSB for people who are in treatment? Or where do you recommend that people go? You had mentioned a couple.
Well, I think NAMI is...
And what does that stand for?
National Alliance of the Mentally Ill. Yes. And NAMI is a wonderful, wonderful resource, not only for support, but also for advocacy. They will also help people understand the laws in whatever jurisdiction they live in and how they affect their ability to seek treatment for their loved one or their loved one's ability to refuse treatment or engage in care in the public sector or private sector. They have been a wonderful resource that we have partnered with throughout the decades that I've been with the CSB, and we have linked family members to them. We've done presentations with NAMI in the community to better educate our community partners, as well as aligning them with some of our private sector partners like Inova as well, or HCA Dominion, to connect people with care options. Inova has been a wonderful partner. They're on our 4th floor. We have engaged in a private-public partnership here in this building, and we routinely will refer patients to them and them to us if we are unable to kind of meet that client's needs, or they don't meet our priority population requirements, or if we both need to address somebody's involuntary need for care.
I was going to ask, who is eligible for CSB emergency services, and are there costs?
Anybody can come in and actually access emergency services here with Fairfax County. And again, we're 24/7 and 365 days a year. We do bill many insurances. If we don't take your insurance, we're likely to go to a sliding scale. And that sliding scale can go all the way down to 0 if your income is such that you're below the poverty line. We can certainly address that. And if you are here connecting, our CAS staff or our admin staff will certainly work with you on how to address your treatment needs, but also meet your specific financial needs as well.
Thank you.
Yep.
We didn't mention mobile services, and I know you've been deeply involved in the mobile services going out into the community for many years and supporting the police department as well. Would you like to touch on and describe the CSB's mobile services?
Yes, I would. The mobile services have actually expanded quite a bit. We've had the mobile crisis unit for a long time. It's been actually established in 1976. And it was one of the first in the nation. So, again, Fairfax County was on the cutting edge of a treatment modality. And it really was at the behest of our law enforcement partners in the community that they needed clinicians to respond to them, in real time, or that they could make referrals to come out and address the crises or mental health needs of people in the community. Typically, mobile crisis was designed for those that are unable or unwilling to connect with the traditional mental health system, whether in the private or public sectors. But we've expanded as well to include the community response team, which is a clinician and a fire and rescue medic that go out and address individuals who may be utilizing the 911 system a little bit more readily than what would be normal. And so they go out and really connect with that individual and figure out what are their needs. And are they able to connect that individual to whatever needs they may have, whether they be mental health or medical, or really accessing that person's natural supports and connected systems like their primary care physician to address whatever needs they may have. The most recent expansion that we have is the co-responder team, which is a clinician and a law enforcement officer are riding in a car, doing a patrol of certain areas of the county, and really looking for mental health crises that may come up through the 911 dispatch system. They can either self-dispatch through the computer-aided data system, the CAD, or 911 themselves may reach out to them and ask them to respond to a certain area and an individual in crises. And the role of that co-responder is really to assess that individual real time and help them avoid that inpatient experience through the TDO process, or temporary detention order process. They're there to kind of mitigate the crisis, de-escalate the situation, and hopefully link that person to some sort of voluntary care or treatment.
It's fascinating, and we're so fortunate to have these services in Fairfax County, frankly. And I have one more question, and maybe people who are viewing or listening or thinking about this as well. What do I do if I see a mental health situation in my community? Do I automatically call 911? Do I get involved and say something to the people? What do I do?
Well, I think first and foremost, be cognizant of what your willingness to be involved is, and also treat that person with compassion and empathy. They're likely going through one of the worst days of their life and really just need someone to talk to in most instances. So if it's a loved one, being able to kind of listen and really engage that individual in a conversation of what's going on. You may decide that you need to enact some sort of professional contact like myself or the mobile crisis unit, or bring the person into Merrifield Center. We're more than willing to see that individual. But there are also other resources out there that you can educate yourself as well. Again, NAMI is one of them, as well as the county's virtual mental health first aid courses. There's youth mental health first aid, as well as mental health first aid for adults, and mental health first aid for first responders. So it allows people to gain the knowledge to identify a person in mental health crisis, support them through that crisis, and also make the necessary referrals to a treatment provider if needed.
Thank you so much, Steve, and thank you for taking time to share some of these really critical emergency services for mental health
Very
for
well.
people in our district. It really appreciate it, especially now, on a very tough week that we've all had, and I'm sure you and your colleagues have had as well. In closing, is there anything you'd like to add for the residents of our county and our towns and cities here in Fairfax?
I would like to add that you're welcome to come in. You're welcome to contact us. We're more than willing to have those conversations that may be tough, and really talk about options and opportunities for care and access to care.
Thank you so much. Appreciate it.
You're welcome. Thank you.